Alright, hello.
Hi.
Angie. My name's Jacqueline. I'll be your nurse practitioner today. What brings you into our clinic?
Just a wellness visit.
Alright, so I'm ensuring privacy, closing the curtains, doing hand hygiene. At any time, if you have any pain or discomfort, can you please let me know? During the exam, I will also be observing for discomfort. Before she did come in here, we did check her vitals. Everything appears normal. We also did a visual acuity screening, which is cranial nerves 2, and that was all good. She has 20/20 vision. Angie appears to have good hygiene. She's appropriately dressed and she's well nourished. And she also reports access to healthy food, which is her general nutrition looks good. Source of reliability is the patient herself. She is alert and oriented ×4, so she is reliable. Chief complaint is a wellness visit, and her HPI is a 28-year-old female here for a wellness visit, no other complaints. She denies any medications that she's currently taking, denies any environmental or drug allergies, no past medical history, no past surgical history. GYN, she's all up to date. Her last pap smear was 2 years ago. She's currently having Menenses, which is normal. And her last breast exam was also with her pap smear, which was 2 months ago, and that was normal. Denies any psychiatric illnesses. Health maintenance is appropriate to age, and she's all up to date on her vaccines. Family history, we would go back 3 generations, but she reports no significant familial history there. Social history, she's currently working full-time. She is not married, and she denies any tobacco use, denies any alcohol use, and denies any illicit drug use. Before we started, we also did a comprehensive review of systems, and she has no complaints. Alright, so we're just going to go ahead and start with your hair, skin, and nails. So just going to look at your skin. It's the color is consistent with your ethnicity. You seem very warm, and your skin looks great. Nails, no clubbing. Capillary refill is less than 3 seconds, which is normal, and everything is evenly there. Your hair is evenly distributed, and it looks very clean, and you look very great. Your head, just going to go ahead and take a feel at your head and your scalp. Your head looks symmetric. I'm just going to go ahead and palpate. Any pain?
No.
No lesions, lice, or anything abnormal there. No redness or anything. Face is symmetric. And before we start that, we're just going to go ahead and go through the cranial nerve. So facial, which is cranial nerve number 7. Just go ahead and smile for me. Perfect. Everything looks symmetric there. Trigeminal nerve, which is cranial nerve 5. I'm just going to go ahead and palpate the TMJ here. Go ahead and open and close your mouth. No popping or clicking, but any pain?
No.
No, denies any pain. Just going to check for cranial nerve 11, which is the spinal muscle. So just go ahead and shrug your shoulders. Perfect. And before I forget, just going to go ahead and have you shrug against me so that checks your strength as well. We're going to do the eyes later, but just go ahead and going to check your tongue, which is going to do cranial nerves 9, 10, and 12. So for tongue movement, just go ahead and stick your tongue out, move it side to side, up and down. So no deficits there. Gag reflex is cranial nerves 9 and 10. We're obviously not going to do this for this video, but it is positive. So everything is great there. Before we move on, we're just going to go ahead and check your head, just your sinuses. So we're just going to go to frontal, ethmoid, and maxillary. Any pressure there, sinus pressure? No, very good. Just going to palpate your mastoid. And then, any pain?
No.
Okay, and then TMJ again. Any pain?
No.
Perfect. And then we're just going to go ahead and palpate the lymph nodes here. So submandibular, submaxillary, pretracheal, and then subclavicular. So no palpable lymph nodes there, and then you would also palpate the axillary lymph nodes. I'm just going to go ahead and just look at your neck before we move on. Everything symmetric, no lumps or lesions or abrasions. Trachea is midline, everything looks good there. All right, before we move any lower, I'm just going to go ahead and look at your eyes. I'm going to just check for your cranial nerves 3, 4, and 6, which is eye movement and then pupil response. So with eye movement, you're just going to go ahead and follow the pen light with just your eyes, don't move your head. Perfect. And I'm going to check accommodation, convergence. Perfect. And steer here. And then that's accommodation where you look far. Perfect. That looks great. And then your pupillary response, I'm just going to check for direct and consensual, so I'm going to check it twice. First, while following the pen and looking there, your pupils are round, equal, and reactive to light on both sides. And now while I do that, I'm going to look at that eye. And now I'm going to look at this eye. Perfect. Everything looks good there. So that's cranial nerves 3, 4, and 6. So we already went through almost all the cranial nerves. I'm going to inspect your external eye. No sagging, no drainage, anything like that. Your sclera is right. I'm going to go ahead and check your conjunctiva, which is no redness. Everything looks good there. Eye movements, everything has been good there. Now I'm just going to go ahead and check your eyes for red reflex, and then also just make sure that your eyes look good. I can't put this on. Alright, so I'm going to just go ahead and check your eyes here. Just go ahead and stare at my nose. I'm going to check for red reflex, which is positive. Disc margins are sharp. I'm going to check over here. No hemorrhage is noted. Disc margins are sharp. Red reflex is present. So everything looks great there. With that, we're now going to move to your nose. Oh, yes, your nose. So, septum is midline. We're going to check for patency, so I'm just going to have you cover one and exhale, and cover the other, exhale. Now I'm just going to check your turbinates. I would put this to the nares. Terminates pink, septum midline, no obstruction, everything looks good there. Since I already have this in my hand, I'm just going to go ahead and look at your mouth too. So just go ahead and open your mouth. Mouth is moist, no oral thrush or anything, and no exudates or erythema to the nose. So everything looks good there. Skin still looks good. Now I'm just going to go ahead and take a look at your ears. So first I'm just going to inspect your ears. Ears are symmetric. Your external ears, no discharge, drainage, or anything like that. While I'm checking, I would normally be checking both ears, but for the purpose of this video, everything is used one-sided. But first, I'm just going to inspect the external ear canal. Everything looks good there. No drainage, anything like that. Just going to go ahead and take a look. No obstruction. Tympanic membrane is pearly gray with good cone of light, no wax or drainage, anything there. Any pain or discomfort? No, very good. I would also be checking on the other side as well. So I checked your ears, your pinna, everything is symmetric and very evenly placed. Before we move away from hearing, this is cranial nerves 8, which is just also going to check for balance. But this is called the Weber test, where we're going to check for evenly vibrations to both sides of your ears. So tell me if you can hear the vibrations evenly to both sides. Perfect. Now we're going to check, we'll do it later, which is a Romberg's test, which also checks for balance as well. We're going to check for air conduction to bone conduction. So what normal is, air conduction is greater than bone conduction. So first I'm just going to hit this. I'm going to go ahead and place this onto your bone, and you can tell me when it stops, okay? Perfect. So her air conduction is greater than the bone conduction, and I would do that again to the other side. So any changes in your hearing or anything like that? Okay. Since I just saw her eyes, her visual acuity is 20/20, so everything looks good there. Her eyes look even, symmetric, and everything like that. Nose patency was good. Mucous membranes are moist, and tongue, everything up there is great. Before I move any further down, we checked a look at your neck. No lumps, pulsations. Since I check your carotid artery, 2+. No lumps, lesions, abrasions, no palpable lymph nodes from what we had checked already. I'm just going to go ahead and check your thyroid here. So I'm going to go from the back. Just going to go ahead and palpate your thyroid and go ahead and swallow. Perfect. No masses or anything felt there. Any pain? No. Any difficulty swallowing? Changes in appetite? No. Okay. So since we already checked all the lymph nodes, I did, right? Okay. Forgetful. Just kidding. Alright, now we're going to check for your chest. So anteriorly, chest is symmetric. Posteriorly, chest is symmetric. No use of accessory muscles. Inhale and exhale. No barrel chest is noted. So everything looks good there. I'm going to listen to your lungs. But also, while I'm also in the front, I'm going to listen to your heart sounds. Before I go to your lungs, I'm just going to listen to your carotid just to make sure there's no blurry. Okay. Before I move on, I would also, the JBP would be 3 centimeters above the sternal angle with her head of bed elevated at 30 degrees, so that is normal as well. We're going to now take a listen to your lungs. So, just listening to the lungs first. I'm going to go under here. Alright, now I'm going to go ahead and take a listen to the heart sounds. So, aortic, pulmonic, curves, tricuspid, mitral. That's with the diaphragm, and now I'm going to switch it over to the bell. Aortic, pulmonic, curves, tricuspid, mitral. Since we listened there, I'm also going to go ahead and just palpate for the TMI, or PMI, which is point of maximal impulse. So I would just keep palpating here, and then once I find the tapping, which is going to be 7 centimeters lateral to the midsternal line in the intercostal space, that will be normal. So everything looks good there. Now I'm just going to have you turn around for me so I can take a listen to your lungs. Don't lay down just yet. I'm going to have you move. Can you move your hair out of the way for me? Thank you. Alright, so first, I'm just going to take a listen to your lungs back here with the diaphragm. Perfect, everything sounds good there. I'm going to put my stethoscope down. Now I'm going to check for respiratory excursion. So I'm going to place my hands, both of my hands bilaterally on your back here. You're just going to go and inhale, and then my hands will move laterally equally, which is normal, so that's a normal sign. Now I'm going to check for diaphragm excursion. So basically, first what you're going to do is exhale and then hold it. So I'm going to percuss. Alright, now you're going to inhale and hold it, and I'm going to tap. And now I would measure the difference, and I would do this on the other side too, but I would measure the difference, make sure it's equal, and the normal is between 3 to 5 centimeters, and hers is 4 centimeters, so that is normal. We're going to check for tactile firmitis, so that is basically evenly distributed vibrations to both sides bilaterally, so 99, 99, 99. Perfect. And now I would also check for CVA tenderness, so let me know if you have any pain.
Nope.
Perfect. Alright, so you look right there. You can go ahead and turn back towards me. We listen to your heart, we listen to your lungs. Yes. Now I'm going to have you lay down on your back. Now we're going to just check your abdomen. Alright, so first I would just inspect the abdomen. There's no scars, no hernias, no rashes noted. No striae noted. I'm just going to grab my stethoscope here. And I'm going to listen to all 4 quadrants, starting with the right lower quadrant and then moving. Now I'm also going to check for the aorta. Just take a listen to the aorta. And then I'm going to take a feel. Go ahead and inhale. Perfect. Now before I move on, I'm just going to go ahead and take a listen to the, since I listened to the aortic, I'll listen to the renal, iliac, and the femoral arteries. And there's no bruits there. Before I move on there, you look, listen, and you're going to feel. So now I'm just going to do some percussion. I would do that in all 4 quadrants here. And then do light palpation, any pain or discomfort in all 4 quadrants. And then deep palpation to all 4 quadrants. And everything looks normal there. And I already palpated the aorta. So now we're going to go to check Murphy's sign, which is basically in check your appendix. So basically I'm going to have you inhale, and then I'm just going to pressure here. Any pain?
No.
Okay, so that is negative, and that would be testing for happy. Now I'm going to go ahead and move down to the arbitrators. This is just going to also check for quality as well. So now you're going to go ahead and bend your knee, and I'm going to externally rotate. Any pain there?
No.
Perfect, so that is negative. And then the last one is a psoas sign, where you're going to lift your leg, and I'm going to push resistance. And if you have pain, then you're going to have pain right here in your psoas muscle, but that is negative. Perfect. Now, since you're laying down, I'm just going to go ahead and check your legs. No edema or anything noted. I'm going to have you wiggle your toes. Go ahead and twist your ankle, checking for range of motion. Just going to check your strength to your ankles. Go ahead and push up, push down. Perfect. Push up against my hand, push down. Check pedal pulses. And then check radial pulses here before I forget. Alright, and then now you're gonna, I'm gonna check your hip range of motion, so go ahead and bend both of your knees, or just one, and then move externally, and then internal rotation, and then do that again while I check here. You're gonna go ahead and push against my hand, perfect. So I'm just checking for strength and range of motion at the same time. For your knee, just go ahead and move it down and back up, checking range of motion, and then push against my hand. Perfect, just checking for strength, and I would do that to the other side as well. I checked range of motion to the ankles and to the feet and to the toes. No pain or discomfort, right? All right, that looks great. Now I'm gonna check for what's called McMurray's sign, which is gonna check for the meniscus. So I'm gonna basically hold the knee, and then at the bottom of the foot, I'm gonna rotate, and if you have any pain, I'm gonna apply pressure. Any pain? Alright, so that's checking the meniscus, and there's no pain there, so that looks great. Next, what I'm going to check is the varus and the valgus, which is the LCL and the MCL, if there's any tears there. So I'm going to push against the knee and against the ankle. Any pain?
No.
And then I would do that, vice versa, and then again on the other side. So since she has no pain, that is negative. The next one is the anterior drawer, which is checking the ACL. So what I'm going to have you do is go ahead and bend your knee, and I'm going to go ahead and sit on your knee. I'm going to pull it towards me and then away from me. Any pain?
No.
Any pain?
No.
Perfect. So you're all good there. You can go ahead and sit up. Thank you. Now we're going to check for what's called Apley's, which is just going to check your shoulders. So you're just going to go ahead and externally rotate, touch your spinal, your shoulders there. No. Yes. And then you're going to internally rotate. And I'm just going to check for both sides, make sure it's even, internal and external rotation, which is even, so that is great. Next is the empty can test, which is going to check for nerve impingement. So basically you're going to hold a can, hold 2 cans, and dump it all out. Perfect. You're just going to hold against, no resistance, make sure there's resistance. Any pain?
No.
Perfect, and that's negative, so she's fine there. The next one is drop arm test. You're going to hold both of your arms up. You're going to go against resistance. And now you're going to slowly bring your arms down. And that's just going to check a shoulder tear. If she's holding it up and then just drops it down without bringing it down slowly, that would be a sign of a shoulder tear. The last one is the apprehension test. So what I'm going to have you do is flex your elbow like this for me. Perfect. And then you're just going to go ahead and I'm going to move your arm back like this. Do you have any pain?
No.
Perfect. And that would be good. So if there's pain, that would be positive, but it's negative. So the next one is 2 tests for carpal tunnel syndrome. So you're basically going to have your wrist like this. I'm going to tap it. Any pain?
No.
Okay, so if there is no pain, then that's negative. The next one is she would be standing up for this one, but it's the Fallon's test. So you're going to put the back of your wrist together like this and just hold it for 1 minute. And if there's no pain, then you're negative for carpal tunnel. Before we move on to you standing up, we're going to do some neuro checks. So you're going to do a finger to nose test. So I'm just going to hold my finger here. You're going to touch your nose to my finger. And again. And last time. Perfect. The next one is going to be rapid alternating movements. So you're just going to place your hands on your thighs and just move it back and forth just like this. Perfect. Now you're going to do the heel to shin. So just move your heel down to your shin. Move it on the other side. Perfect. And then now is the Romberg sign. So I'm just going to have you stand straight up. And you're just going to raise your arms and then close your eyes. I would be next to her in case she did get dizzy, but because she's not swaying, that's what we're looking for. All right, you can go ahead and open your eyes. Just go ahead and walk straight for me normally. And then all the way back, you're going to do walking on your heels. And then now you're going to walk on your tippy toes. And then you're now going to do a heel to toe, which is the tandem. Perfect. And on the way back, before you come and sit down again, I'm just going to have you do a shallow knee bend. Perfect. Any pain?
Nope.
Okay, now I'm going to be turning around. I'm just going to check your spine range of motion also. So just go ahead and bend straight down. Do you have any pain when I'm checking your spine here?
Nope.
Nope. Okay, perfect. Everything looks good there. Turn back around. Now I'm just going to check your upper extremities, your musculoskeletal. So just go ahead and do some big arm circles. Perfect. And I'm going to just palpate here while you do that again. Just going to check for any joint stiffness or any cracks or anything like that. Perfect. Now I'm going to go ahead and hold your elbows. Can you just move your elbows back and forth? Perfect. Now your wrist, can you just kind of move your wrist like this? Perfect. And your fingers, any numbness or tingling? Perfect. Go ahead and squeeze my fingers. Don't break it. Radio pulse is just going to check one more time. I'm going to just check against your elbow strength. So push up against my hand, push down. Now bring your arms up like this. Push against and away. Perfect. Now your shoulders, just push against my hand and then up. Perfect. Everything looks good there. All right. Now you can take a seat. Now we're just going to do some sharp and dull pain differentiation here. But before we do that, we should do bone to bone conduction. So I'm going to do this to your bony prominences on both of your wrists and then your greater toes. So do you feel the vibration?
Mm-hmm.
How about here?
Yep.
Yep. Greater toe?
Yep.
And this toe?
Yep.
Perfect. Very good. Now sharp and dull pain. So this is dull. This is sharp pain. Feel that?
Mm-hmm.
Yeah, it's really sharp. And then this is the dull pain. Okay. All right. Now I'm going to do this in 3 different spots. Okay?
Mm-hmm.
So close your eyes.
Sure. 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 Dull.
So that was my finger.
Sure. Wait, this is dull, that's sharp.
Yeah. Okay. Great. Great job. No deficits there. Let me just put this back. Now we're just going to check the deep tendon reflexes here. So I'm going to do the biceps, triceps, and then brachioradialis. So biceps, I'm going to hold this here. Perfect. Brachioradialis. Perfect. And then this here. Perfect. Now I'm going to have you scooch all the way back so your feet or ankles are kind of hanging there. Now this is your patellar deep tendon reflex. Perfect. Oh, you did that. Okay, we'll do that one more time. There we go. Okay, now we're going to check for the Achilles. I'm going to go back here. Perfect. And now the Babinski, which she would be laying or whatever, and then you would just go like this, and it's negative. So that's all good. Otherwise, any pain or discomfort anytime?
Nothing.
The last one, when she was also doing the Romberg, that was also cranial nerve 8, so that was intact as well. Otherwise, I think that's it. Any concerns or questions for me?
Nothing.
All right, we'll get back to you in a bit, but otherwise your exam looks great.
Thank you.
Thank you.